Welcome to another edition of Pancreas School, and I'm really fortunate to have Michele Derdzinski, who's joining me today from our Department of Nutrition. And Michele has the misfortune of having to work with me every Tuesday. And if you can believe it, over the 33 years that I've been taking care of patients with pancreas cancer, I've actually only worked with, I think, 4 or 5 nutritionists. And Michele, I think we've been together for a number of years now. I can't remember how many years, but it's a long time. And I think the important part of this is Michele has an amazing experience in the care of patients with pancreas cancer. And the area of nutrition creates so many questions. And we're going to try to answer most of those in this lesson of Pancreas School. And you can see my outline. We're going to go over anatomy, physiology, principles of nutrition, enzymes, and then the importance of a schedule, especially for the patient, and the family can help with that as well. So I know the anatomy and physiology will be somewhat of a review. Michele, thank you again for joining me today. So I'm going to start with normal anatomy, and that's the stomach. Pancreas sits in back here, and remember the pancreas was just put in a unique location. Why that is not really always clear. We're going to put the gallbladder in, the liver. So this is the liver here, the gallbladder, the stomach. The first part is called the duodenum. And then the bile duct goes behind the duodenum, enters into the pancreas. This is the pancreas in behind the stomach. Enters into the pancreas, merges with the pancreatic duct, and then ends in the ampulla of Vater. So when we eat and take a nutritional drink, for example, hormones in the stomach and the duodenum cause the gallbladder to contract. Bile is then squirted out through this one-way valve in the ampulla, along with pancreatic enzymes. So the pancreatic enzymes from the pancreatic duct and the bile from the liver and gallbladder allow us to digest our food. That's important that mixes with the food. The pancreatic enzymes are one function of the pancreas, a really important function. We call it the exocrine function of the pancreas. The pancreas also has an endocrine function where it makes hormones, the most common being insulin. As everyone knows from prior editions of the Pancreas School, many times cancers of the pancreas occur in this location, and they are removed with what's called the Whipple operation. And the Whipple operation removes this area right here. We're going to divide the pancreas. We're going to take that first part of the small intestine and the duodenum. We're going to come up and take the gallbladder, and all that is removed with a Whipple operation. The pancreas does not regenerate, and therefore the number of enzyme-producing cells and enzyme processing cells that remain will determine how much of the pancreatic exocrine function that's important for digestion actually remains. So if we were to draw then how the anatomy looks after a Whipple operation, here is our pancreas. We have the pancreatic duct, which is where the enzymes will come out of the pancreatic duct. We take out the gallbladder. So our bile duct is there. Liver is here. And the stomach is right there. We'll just put the stomach like that. And we hook this up by bringing the intestine right here where we divide it. I'll put a little A there. We bring the intestine up and sew it to the pancreas. There's A. Sew it to the bile duct. And then we come around to the stomach. This is our stomach. This is our remaining pancreas. And that's how, if you will, the post-Whipple or after a Whipple operation, how things look. And you can see that we've taken out probably about 40% of the pancreas. So to the extent that the pancreas produces insulin, the patient may need insulin or an oral medication to control their blood sugar. And importantly, they frequently require pancreatic enzymes. even though in most cases we sew the pancreatic duct directly to the intestine, so there's no obstruction to the flow of pancreatic enzymes, the pancreas has received all the chemotherapy and the radiation that the patient has received. The enzyme output is oftentimes decreased. There's less pancreas, and in fact, sometimes this narrows down, and it's harder for the enzymes to actually make it into the intestine. So patients may have symptoms of pancreatic exocrine insufficiency, and I guess you hear that on the radio now all the time, and that's why taking the enzymes and having a schedule and mixing them with the food is so important. So this is the anatomy of the patient before the operation, the anatomy after the operation. Michele, now maybe we can turn to some principles of nutrition. And I think we have over the years we've produced 1 million handouts. I think we're hoping that this video even adds that extra level of education, so that, because it generates so many questions.
Yeah, it generates a lot of different questions, and it's a area that frankly sometimes starts over here too. So our patients get diagnosed with pancreas cancer and then might go through chemotherapy and might go through radiation, and the reality is several are on enzymes at this point, but many are also on enzymes at this point too, going through chemo and radiation.
Before they've ever had surgery.
Before they've had surgery.
And that's because oftentimes the tumor here, and you can see the tumor right here, the tumor may obstruct the pancreatic duct, right?
Right.
So even though we haven't taken out part of the pancreas, the enzymes can't make it into the intestine.
Yeah. So what's important is that even though we're not used to, and oftentimes patients aren't necessarily comfortable talking about GI issues and bowel habits, it's really important to go outside of that and start having that open conversation with your providers on what do my bowel movements look like, what are my GI issues I'm experiencing, because there's a lot that we can do to help.
So Michele, that's a great point. So if someone is having pancreatic exocrine insufficiency, in other words, they need enzymes, what are the symptoms that they frequently have?
Yep, so patients probably are going to have bloating with meals especially. Their bowel movements are often more than twice a day. They often are not formed. They are going to be floating, tan, greasy, usually real smelly, and just a lot of gas as well. So unpleasant, but luckily there's something that we can do, which is giving them these enzymes.
And rarely, I mean, we see this certainly every now and then. The initial manifestation of pancreas cancer is actually pancreatic exocrine insufficiency, where the tumor has blocked the pancreatic duct, and the patient notices that their bowel movements are more frequent. They're quite malodorous. They are smelly, and even if they don't notice it, the person that they live with notices it. We mentioned in previous episodes of Pancreas School that patients can oftentimes present with an elevated blood sugar as well. But anyway, pancreatic enzymes.
Yeah, so if you find that you feel you're having these issues, you talk to your provider, we can start you on some pancreatic enzymes. So essentially what you're doing, similar concept to replacing insulin, which the pancreas also makes, you're doing the work of the pancreas yourself. But how extensively you need to do that is what we have to figure out together, and then that hope over time you gain independence and comfort level of yourself titrating and adjusting these medications to control your symptoms. So basically your pancreas makes lipase, amylase, and protease, which helps to break down protein, fat, and carbohydrates, and then that's what is contained inside of these capsules.
And the capsules have to be taken with food. Right? I mean, it's one of those things where, and I think as we get older and we're used to taking medications for like blood pressure or high cholesterol, and you take them maybe in the morning and at night, the pancreatic enzymes, remember that the body produces our enzymes in synchrony with when we eat. The stomach and the duodenum tell the pancreas and the gallbladder to excrete their secretions into the intestine. So they're putting those enzymes in there just at the right time. Now that either there's a tumor obstructing the pancreatic duct or we've taken part of the pancreas out, Now it's up to the patient to take the enzymes with the food.
Right.
Right?
Yeah, and in some sense, our GI tract almost has its own separate brain. So we eat, and the GI tract signals, I need to release enzymes. But whether your body's able to do it or not, we don't know. So if you are having those symptoms of pancreas insufficiency, you have to act as that brain, and you have to take it with the meals. So typically, like Dr. Evans was showing, it'll release it as we eat. So basically what you should do, say you're taking one capsule with each meal, you can take a bite of food, take the capsule, finish the meal. But there are several patients who have to take several capsules with the meal, so it's better practice to stagger them throughout the meal because it better mimics that effect that the pancreas would have.
And we oftentimes tell our patients that we can't really prescribe whether they need one Creon, and maybe you can also talk about the difference between Creon and ZenPep, which are the two major brands. But they may need one with a meal, they may need 3, they may need 4, and they also come in different strengths.
Right.
So the patient has to kind of titrate the enzyme production to what their body is telling them, right?
Yeah, absolutely. So the brands in the U.S. are Creon, which is what the hospital carries, ZenPep, these are the two most common, Pertzi, and Pancreas. So we use these two the most, largely because they come in the highest dose. So Creon, for example, comes in a 36, it comes in a 24, a 12, and a 6. And what those numbers are indicating is how many units of lipase, which is what helps to digest fat. And if we're not digesting fat, then that's when we're having those floating, tan, oily bowel movements. So that indicates how much lipase is inside of that capsule. So basically, we start the dose depending on what the patient's reported bowel habits are. So if the patient is having just a couple of bowel movements a day that are smelly and at baseline historically has been constipated, we might start them on a little bit lower of a dose. The 6 is more often used in the pediatric population. But say the patient comes in and is having 5, 6 bowel movements a day, they're clearly having tan color, oiliness, etc. We'd probably start them on that 36 and have them go ahead right away and take 2 or 3 capsules with a meal.
Yeah, so such great information, Michele. And one of the other things, and we can come back to anything that you want to discuss more about pancreatic enzymes. I think this is a great primer so that patients know that they have to adjust the dose on their own. Mm-hmm. Certainly, they can call you and get in touch with you and communicate with you anytime. And they have to take the enzyme with meals. Right. And maybe at the end of the lesson, we could talk about some of the things we do when that just still isn't working. One of the other challenges that patients have, both at diagnosis, certainly during chemotherapy and radiation, and certainly after surgery, is oftentimes maintaining their weight. Especially for those adults who have gone into later life and have not gained a lot of weight, they've usually had to do that intentionally. So they've had to limit. We know that as we get older, if we have Bluebell ice cream every night, we're going to gain weight. So many adults have decreased the frequency of their meals, oftentimes only eating largely an evening meal with a tiny breakfast, tiny lunch, and then all of a sudden we have to get more calories and protein. What are kind of your principles of increasing calories and protein for patients with cancer?
Yeah. Well, first of all, we always talk through how habits are really hard to break, right? If somebody's eating once a day, it's acknowledging that habits are something we have to work through, and that's okay, but trying to meet them first and say, let's try to eat 2 or 3 times a day. Knowing that the eventual goal, if their meals are very small, is really 4 to 6 times. Because if our meals should be this big, oftentimes what we see is our patients' meals are actually this big. And if they're eating that 3 times a day, that frequency will catch up with them and they will lose weight. So it's figuring out what they can do in between these size meals, which often is snacking, right, on high calorie, high protein snacks. So we go through what types of foods have protein in them. So that's going to be your meat, eggs, fish, dairy products, nuts, nut butters, and then figuring out which types of those foods the patient likes and can incorporate into their current meals and snacks. So basically we talk through essentially a schedule. So we encourage people to try to have something every 2 to 3 hours and try to really avoid prolonged periods without eating, which is easier said than done, especially because oftentimes our patients lack hunger cues, especially right after surgery specifically.
Great point. Right, yeah, especially after surgery, that appetite and the desire for food just isn't there. That's such a great point. And one of the things that Michele knows that I harp on all the time is a schedule. And that schedule is just so important. So we oftentimes say naps are good. Staying in bed until half the morning is not good. And especially when people aren't feeling well, they're having side effects from chemotherapy, or they've just had an operation, and they're not feeling well, and that bed or the couch is much more attractive than anything else. It's hard to find that motivation to adapt to a schedule, but having a schedule is just completely invaluable. And also, Michele and I both get excited when a patient comes in, typically with someone. It's rare that we see patients undergoing active treatment or within the first couple months of surgery that come in by themselves. They'll usually have a family member with them. And I would encourage everyone to have a patient advocate with them when they come to a doctor's appointment, or even an appointment with one of our APPs or with Michele or one of her partners. It's always good to have someone with something to write on. I get just so charged up when I see someone with a pen and a notebook. Right? So they're going to be taking notes. And I think it's much more likely that patient then is going to have a schedule. So, for example, have a schedule every day. So the way that my wife controls me, for example, is there's a calendar in the kitchen. I suppose almost everyone has a calendar in the kitchen, right? Well, I have to look at that calendar in the kitchen almost every single day, because it has my notes as to whose birthday it is and who to call and everything else. But having that schedule, so if someone is going to wake up, for example, at say at 7:30 in the morning, and then there'll be breakfast, and then there'll be a snack and lunch, and you can see how you could easily fill those in. Then when you meet with Michele, you could fill those in with some helpful suggestions. And then for our patients, I oftentimes encourage them, if you don't feel like having breakfast, by no means have it. I mean, you shouldn't. You should not force anything. If you're not feeling well and you're nauseous, for example, then the last thing you want to do is eat. But it will be a conscious decision to not have breakfast. After breakfast, you might want to take a nap, but you will have gotten up at 7:30 in the morning. The same thing with snacks and meal times. If you don't feel like it, then obviously don't take it. I think the other aspect of this is if you realize that during the day you're not taking in an adequate amount of nutrition or liquid to remain hydrated, you would call us. And we would hear from that patient sooner, because they would have the cue based upon the fact that they weren't making a number of the milestones that they had set out for themselves. What are kind of the tricks that you do in talking with patients, especially when they're a little bit fatigued? I mean, it's normal with cancer, and how do you kind of boost them up?
Yeah, I think it depends on what stage of treatment they're at, right? So if they're going through, for example, chemotherapy and radiation, which a lot or most of our patients are, there may be some different side effects. So what this has on it might differ if someone, for example, is having taste changes or cold sensitivity. And with radiation, often as the more radiation goes on, they can get diarrhea. And the food choices here all revolve around that for symptom management, right? So there's two principles with nutrition in terms of weight maintenance or weight gain for a lot of people who need to gain weight and muscle mass, but then also tailoring what you're choosing to eat based on your symptoms. We also find that a lot of times it's easier to drink fluids, right? So if someone's saying food is going down, but food is not going down, but fluids are easier, then they can do protein shakes, and most of our patients do that anyhow, especially after surgery. We recommend they do 2 or 3 a day, and we pepper that in here to some extent based on if they are on insulin. So if they're on insulin, they could maybe do a lower carb shake here, but if really their goals are to gain weight, and they're on insulin, they do shakes at meal times because they have more calories, but they have more carbs then too. So they would account for that with insulin at the meal times. But some of the brands to know about too are going to be Boost. There's one sold in the Freighter Cancer Center Pharmacy called Very High Calorie. It has a good amount of sugar, however, it also has 530 calories that can turn around somebody's weight. Often if someone's gradually losing weight, about 250 to 500 calories can help them turn that corner. The other one that's good is called Ensure and Live. That one's 350 calories. I like to recommend if they're losing weight, if they can do shakes that are 300 calories or more to really help with gaining weight back.
And they can even make their own shakes too if they want, right?
Yep. Yeah, absolutely. They can use things like regular milk, soy milk, Fairlife milk, which is a cow's-based milk but strips out the lactose and has extra protein. They can add yogurt, peanut butter, ice cream. We have shake recipes that we give to people. So there's all sorts of things that can be made.
Great. So if we had to recap then, enzymes need to be taken based upon an individual's bowel function, right? How they're feeling, how many bowel movements, whether their stools are malodorous, if they clearly have pancreatic exocrine insufficiency, frequent loose bowel movements that are greasy and smelly, they need more enzyme. Adjust the enzymes based upon your bowel function. Have a schedule. And if you come to the nutritionist, bring a notepad and a pen. What else would you leave our viewers today with?
Just always knowing how to reach us too. So for seeing a dietitian, it again kind of depends on the stage where you're at. So over here, chemotherapy, that's based on doctor referral, or if you have significant weight loss, you'll flag into a messaging system to us. Radiation will automatically work with the patients, and then with surgery we'll automatically work with you as well. But knowing how to reach people anyways through my chart over the phone and developing that comfortable relationship, because we're here to help and it's easy to reach us if you know how. And one extra note before we leave you for today's lesson. These two handouts will be linked below the video. So this one is a frequently asked question about pancreas enzymes, and if you are going through surgery, this is in the nutrition section of the pancreas surgery booklet that you receive. But there's just an extra version of it for you to reference on the web as well. So it goes through just the basic facts that we talked about enzymes. What are they? Who needs them? Why would you need them? Proper ways to take them. And then also acknowledging cost issues. If there was a cost issue with the pharmacy, please call us. That we're here to help you with that too. And then this is a sample menu plan. So this is in that booklet as well. But it just goes through how we were talking about eating something every 2 to 3 hours, protein food examples. So this is here to help you, and we can personalize this, and often do, for your food preferences.
Absolutely. Michele Derdzinski, thank you so much for joining us today.
You.
We'll be back with another lesson of Pancreas School.
Thank you.